Greetings. I'm Dr. Sherry Wilson of Stride Career Prep's Health Career Program, and this is our second episode covering the field of public health. Today, we will meet with Lieutenant Commander Aaron Patterson of the U.S. Public Health Service Commissioned Corps. The U.S. Public Health Service Commissioned Corps, also referred to as PHS, is a team of well-trained, highly qualified public health professionals dedicated to promoting the nation's public health, disease prevention programs, and advances in public health science. These men and women serve on the front lines of the nation's fight against disease and poor health. As one of America's 8 uniformed services, they fill essential public health roles within the nation's federal agencies. Key leaders for PHS are Dr. Rachel Levine, Assistant Secretary for Health and Human Services. Vice Admiral Vivek Murthy, Surgeon General. Rear Admiral Susan Arcega, Director of Commissioned Corps Headquarters. Rear Admiral Aisha K. Mix, Assistant Surgeon General, Chief Nurse Officer. This 2-part series provides an overview of the U.S. Public Health Service and offers a glimpse into what it means to be a public health nurse.
I'm Lieutenant Commander Aaron Patterson. I go by Pat, and I'm originally from the Bronx, New York. I come from a large family of 10. And my career started over 22 years ago, in which I came right out of high school and went into the Navy. And I've been in the healthcare field the entire time. That has led me to a job in which I provide anesthesia as an advanced practice nurse in the United States Public Health Service. So before I begin, a little bit more in depth about my path into the Public Health Service. At this moment, I am a newly graduated certified registered nurse anesthetist, also known as a CRNA. I graduated in May from the Uniformed Services University. CRNAs are anesthesia professionals who safely administer more than 34 million anesthetics to patients each year in the United States. CRNAs are the primary providers of anesthesia care in rural America, enabling healthcare facilities in medically underserved areas to offer obstetrical, surgical, pain management, and trauma stabilization services. CRNAs are the sole anesthesia providers in more than 70% of rural hospitals in the United States, affording 70 million rural Americans access to anesthesia. Before joining the United States Public Health Service, I was in the Navy. I joined the Navy right out of high school at 17. I spent 8 years as an enlisted personnel, and my job was a hospital corpsman. After spending 8 years in the Navy, I went on to nursing school. And then after nursing school, I went on to work in the civilian sector as a nurse before joining the Public Health Service. I joined the PHS after a conversation with a Navy friend of mine. I was very curious about working in the areas that we serve. I knew what my purpose was in life, and that was to help people. So being able to help people who really needed it drew me to the Public Health Service. I enjoy making an impact that is next to none. Currently, I work in the Indian Health Service, and every day I provide care to a population that has limited access to healthcare. Every day, taking care of my patient population, I can see the gratitude and appreciation on every face of my patients. And that is what I like most about the PHS. So a little bit about who we are. The United States Public Health Service is one of the 8 uniformed services. We are the only one dedicated solely to protecting America's public health. Our mission is to protect, promote, and advance the health and safety of our nation. We are led by the Assistant Secretary for Health and the U.S. Surgeon General. We are comprised of nearly 6,100 full-time, highly qualified public health officers. We provide essential healthcare services to underserved and vulnerable populations. We deploy for public health emergencies. As the cornerstone of U.S. crisis response, officers deploy to natural disasters, disease outbreaks, global public health emergencies, and serve on humanitarian assistance missions. We also lead public health programs and policy development. Officers leverage their extensive experience, skills, and networks to provide expert leadership within Health and Human Services and throughout the federal government. We also advance innovation in science. Clinicians and research scientists work at the forefront of the battles against the COVID-19 response, Ebola, cancer, food safety, HIV, mental health, and many more. A little bit of history of the United States Public Health Service. We could trace our origin to the United States Marine Hospital Service, which was implemented to protect against the spread of diseases from sailors who returned from foreign ports and maintain the health of new immigrants. The origins of the Marine Hospital Service can be traced to the passage of an act for the relief of sick and disabled seamen in 1798. This act created marine hospitals to care for sick seamen. In 1870, the Marine Hospital Service centralized hospital administration under the leadership of the supervising surgeon, which transformed into the position of the Surgeon General today. In 1871, Dr. John Woodworth, the first Surgeon General, adopted a military model for the medical staff, leading to uniformed physicians. In 1889, Congress established the United States Public Health Service within the Marine Hospital Service. Officers were aligned with their sister branches, the Army and the Navy, to include titles, rank, and pay. In 1944, we expanded the categories from physicians to include nurses, scientists, dietitians, and physical therapists. Our numbers increased from 625 to 3,000. In 1964, Dr. Luther Terry, the Surgeon General at the time, released a report that smoking was linked to lung cancer and bronchitis. This was the first report connecting tobacco to chronic disease. This was a major footprint for the United States Public Health Service. In 2005, more than 2,400 public health service officers deployed to provide disaster relief to the Gulf region following Hurricanes Katrina, Rita, and Wilma. In 2014, the Public Health Service was activated by President Obama to respond to the Ebola epidemic in West Africa. Over 200 officers deployed to establish a dedicated facility to provide high-level care for national and international healthcare workers should they become infected with the virus. The deployed teams include physicians, nurses, behavioral health specialists, pharmacists, laboratory workers, and administrative management personnel. In 2017, hundreds of healthcare personnel, including PHS officers, deployed to Puerto Rico and the U.S. Virgin Islands to provide care and support and social services recovery following the back-to-back Category 5 storms. So we have 11 categories, and among those 11 categories, we have dental, which comprise our dentists, dietitians, engineers, environmental health officers, which include environmental health specialists, environmental health officers, industrial hygienists, occupational health and safety specialists. We have our health service officers that include clinical psychologists, clinical social workers, dental hygienists, health informatics specialists, health information management specialists, healthcare administrators, medical health record administrators, medical technologists, clinical laboratory scientists, optometrists, physician assistants, podiatrists, and public health professionals. We have our nursing category to include advanced practice nurses, and nurses. We have our pharmacists. We have our medical category to include our physicians, scientists, our therapist category, including audiology, occupational therapists, physical therapists, respiratory therapists, speech language pathologists, and then we have our veterinarians. So we work in many areas in over 800 locations in the United States and in numerous foreign assignments with duty stations in over 20 federal departments or agencies across the nation and around the world. As I stated earlier, I work for the Indian Health Service, which is one of many agencies, which is one of many of those 20 federal departments and agencies. So some of the student pathways into the public health service is our junior co-step and our senior co-step programs. Our junior co-step is our junior commission officer student training and extern program. This is for students in health-related undergraduate, master's, and doctoral programs who can train alongside active duty officers during their school breaks. Participants are paid and receive health benefits, housing, and travel allowances. The junior co-step program lasts between 30 and 120 days. Participants become inactive public health service officers upon completing the program and can activate upon graduation. There is no obligation to join the United States Public Health Service Commission Corps. Our senior co-step program is the Senior Commissioned Officer Student Training and Extern Program. This is for students entering their final year of graduate school or professional training in which they become an officer upon graduation. They could get paid while in school in exchange for committing to enroll in the United States Public Health Service Commission Corps upon graduation. Students receive basic pay and allowances of an ensign, which is an O1 while in the program, and are guaranteed a spot in the United States Public Health Service Commission Corps upon graduation. Service obligation to the Commission Corps is equal to twice the time sponsored in school. So if you were sponsored for 1 year, you will serve 2 years in the United States Public Health Service Commission Corps. Eligibility for the junior co-step program is for undergrads with at least 2 years of study towards a bachelor degree in one of the categories I listed in the previous slide, or master's students who have completed at least 1 year of graduate study in one of the categories that I listed in the previous slide. For the senior co-step program, eligibility is for students within 1 year of receiving a degree in the categories I listed in the previous slide. The benefits for the junior co-step and senior co-step program is that participants will receive the pay and allowances of an ensign, which is an O1. They receive a tax-free housing allowance based on their duty station and dependent status. And they receive health coverage through TRICARE. There are also travel benefits in which travel costs are covered between the student's home and their program location. The current application period ends September 30th. So as you look to the future, take this time to learn all that you can while you can. Develop short and long-term goals. I like to tell individuals to develop a 2-year short-term goal and 5 and 10-year long-term goals. And you update them as you go. A mantra that I live by and I like to pass on to everybody I meet is that a goal without a plan is just a wish. Consider interviewing or shadowing healthcare professionals so that you can get an idea of where you may want to start your career. And explore more than one career path in the health sciences and determine how you want to impact health. So for more information, please visit the United States Public Health Service website, www.usphs.gov. And I want to thank you for your time.
Thank you, Lieutenant Commander Patterson, and thank you for your service.
Thank you.
And congratulations on becoming a new CRNA. To our students watching, we hope that you find this webinar informative as you consider a career in public health. Thanks for watching.